Okay, thanks everyone for joining us. It's great to have so many of you online, and I think there's more to be joining us. We're just at 1 o'clock at the moment, so hopefully a few more will be dialing in. A big thank you to Dr. Diane Ashiru-Oredope, who's our advisor, and she's done a lot of work around our AMR campaign. She's also the one who developed the Antibiotic Guardian campaign in the UK. So we're going to hear a bit more about some of the initiatives in the UK and also from you guys from around the Commonwealth in tackling AMR. So I just want to check that most of you can hear us. If you've got any issues, please just pop a little message in the chat box and I'll try to help you deal with them. So without further ado, I'll hand over to Diane because we've got quite a packed agenda.
Great. Thank you very much, Victoria. Really great to be here. I can see that they can hear us because we have people typing in all different parts of the world where they're from. So we have Nigeria, Malaysia, United Kingdom, a couple of people from United Kingdom already, a couple from Malaysia, India, Trinidad and Tobago, Tanzania. Welcome, everyone. We hope you find this useful. So as Victoria said, I'm the advisor for antimicrobial resistance for the Commonwealth Pharmacy Association. I'm also the lead pharmacist for the AMR program. Sorry, Australia is sleepy. I'm the lead pharmacist for the antimicrobial resistance program at Public Health England in the United Kingdom. So this is our second webinar in the AMR series that we have been doing, and this is really focused around helping you to prepare for World Antibiotic Awareness Week. Vicky, can I check that the recording is on?
Yes, it is on.
Great, thank you. So just to go through some technicalities, so for those of you that have been online for a while, you'll know that the presenters have been having a discussion and going through sound check. Everyone is on mute, so I don't think you can unmute yourself, but please, if you avoid unmuting yourself, and if you're a presenter, please do not share slides because we have all the slides together and we'll talk through that. As we share information, if you're on social media, please, especially Twitter or Facebook, use hashtag CWPharmacists or hashtag antibiotic resistance or hashtag antibiotic guardian, so we can pick up your tweets and your key learning points, and it also means that you're spreading the message with everyone. The webinar recording is ongoing as we speak, and we will make the slides available and the recording available at the end of the session. So the objectives for this session is really for you to find out what happened across the Commonwealth for World Antibiotic Awareness Week 2016, for you to be able to list quick ways in which you can contribute to World Antibiotic Awareness Week, either as an individual or as an organization, and for you to know where and how to access a range of resources that you can use for your campaigns. And as Victoria said, and for the other, that's why we have more than one presenter online, for you to hear ideas and examples of what a range of Commonwealth countries are doing for their plans for World Antibiotic Awareness Week. And this is focused on the pharmacy organizations in the different Commonwealth countries. So why is participating in World Antibiotics Awareness Week even important? I'm just going to give some background information around antimicrobial resistance. Those of you online will know that it is a major threat to the future of healthcare, not just a public health threat, but actually a clinical threat, and it has significant economic implications, which I'll share shortly. Antimicrobial use is a recognized driver, as well as poor infection prevention and control practice. The future, if we don't act now, is that by 2050, there will be 10 million deaths as a result of drug-resistant infections, and this will cost £66 trillion. This is actually equates to $100 trillion, and when we did the calculation and did the conversion a couple of years ago, that equated to £66 trillion. You can see across there where the deaths attributable to AMR is likely to come from every year by 2050, and the fact that drug-resistant infections will cause more deaths than cancer by 2050 if we don't act now. It is also already an issue, so not just about the future. 10 countries across the world are already reporting treatment failures to last resort medicines for treating gonorrhea. And the TB statistics are really scary and are more relevant than sometimes we think. So in 2013, there were 480,000 cases of multi-drug resistant TB. These were the ones that were reported. And as many of us online will know, modern medicine depends on us having effective antibiotics. So treating major surgery, the fact that you need prophylaxis, chemotherapy for those who have got cancer, obviously, or have transplants, it does mean that the immune system is compromised, and so important to have antibiotics available that will effectively treat any infections that might occur. Everybody has a role in tackling antimicrobial resistance. The government has a role. By the government, I mean the governments in the individual countries. At an international level, WHO and ECDC, so the European Centre for Disease Control for Europe, WHO as an international organization has a role. Professional bodies, organizations, and public health agencies and leads have a role. Healthcare professionals such as us online, every single one of us in both human and animal health have a role. The public have a role, and pharmaceutical companies have a role. I've put pharmaceutical companies last because actually if a new antibiotic is developed today, we know that if we don't have prudent use of that antibiotic, what will happen is a resistance will develop, and that is already happening with some of the new antibiotics that are already being developed now and that have gone onto the market. The public obviously have a role in terms of how they use antibiotics. So global action, so the global action on antimicrobial resistance and the global antimicrobial resistance action plan was published in 2015 by WHO and gave a framework for action. And in 2016, for the 4th time ever, a health topic went to the United Nations, and 193 countries signed a declaration to tackle antimicrobial resistance. Again, WHO Essential Medicines List, which many of you will be aware of, has had the first significant update to antibiotics in 40 years, really highlighting the importance of everyone tackling antimicrobial resistance and making better use of antibiotics. So what is World Antibiotic Awareness Week? One of the key objectives in the Global Action Plan, and I won't go into details of that here because that was in the first webinar, is to improve awareness and understanding of antimicrobial resistance through effective communication, education, and training. And so WHO developed World Antibiotic Awareness Week, or launched it in 2015. In many ways, actually, there were already activities ongoing in different parts of the world. The first one was led by the European Centre for Disease Control, so ECDC, and it's the European Antibiotic Awareness Day, which takes place every year and has taken place every year since 2008 on the 18th of November. America already had a week-long activity, and so did Australia and Canada. And so by 2015, it was really pulling together this so that there was a bigger action taking place in all countries across the world. And so World Antibiotic Awareness Week takes place in whichever week the 18th of November falls in. So this year, it is the 13th to the 19th of November. The overarching theme of the campaign is that antibiotics need to be handled with care. So reflecting the message that antibiotics are precious resources and should be preserved. WHO provide resources for use, so they provide resources at the global level that countries can adapt and use, either use it exactly as it is or use it to influence their own local national campaigns. Similarly to ECDC as well, who have been producing EAED resources since 2008. For this, so the campaign objectives around, making antibiotic resistance a globally recognized health issue, increasing the awareness and the need to preserve and the power of antibiotics, to increase the recognition that individuals, health and agricultural professionals and governments all have a role in tackling antimicrobial resistance, which is what I mentioned earlier, and to encourage behavior change and convey the message that simple actions can make a difference. And it is very true. Simple actions can make a difference. So as of the time when I took the screenshot from the WHO website today, there were 38 days, 13 hours, 45 minutes and 4 seconds to World Antibiotic Awareness Week. This was this morning, so pretty much we can say we've got 38 days to the to World Antibiotic Awareness Week. And the key message this year is really around the fact that encouraging the public to seek advice from qualified healthcare professionals before taking antibiotics. So actually, as healthcare professionals, it is really important that we're very much aware of what our role is and making sure that we help to help patients and the public to use antibiotics properly. I'm going to hand over now to Victoria to talk about CPA's activities for World Antibiotic Awareness Week 2006.
Thanks, Diane. So, many of you might have even participated in some of our activities last year. I'm not sure who online would have done it. I think probably Rwanda, Trinidad and Tobago, a few others were aware of this, but just quickly to run you through what we did. So to raise awareness of AMR in the Commonwealth for World Antibiotics Week 2016, we decided we'd like to gauge the current situation and perspectives around especially medicines legislation, what activities were already going on with our countries, and gauge the support for behavioural change campaign Antibiotic Guardian. So one of the things we did is to send out a survey to our member organisations. So can I have the next slide, please, Diane? So we sent out a 10-point questionnaire. So it was constructed in liaison with Diane, our AMR advisor, and we distributed it to 36 member organisations via our counsellors around the Commonwealth using the SurveyMonkey platform. So just a brief rundown on the results. So 26 out of 36 countries responded, so it's not bad for an online survey. 92% had said they had legislations preventing the sale of antibiotics without a prescription. But the thing that really this survey highlighted was, if you click the next bit, Diane, just over 50% of countries said that these legislations were abided by. And the same thing was reflected in terms of when we asked, must a pharmacist be present when supplying antibiotics? And again, the legislations are in place, but only just over 50% of cases were these legislations abided by. And we recognise this is a complicated issue, and it's not simple to solve. But it gave us some important information to then go forward and think about how we might design our campaigns to tackle this at different levels. And we also asked about antibiotic stewardship, and at least 57% of you knew of at least one antimicrobial stewardship program in your country. And this was quite good news, because those of you that did, 57% actually said that the stewardship teams included pharmacists. So when they are going on, it seems that pharmacists are being included. Can we have the next slide? 76% of you were aware of the dates of World Antibiotic Awareness Week, and this is talking about the member organisations themselves, so your national bodies, and all were aware that AMR was a global priority and willing to become and promote Antibiotic Guardian campaign. So this is just an overview of some of the people that have been pledging to be Antibiotic Guardians, and in 2016, as a result of our campaign, we saw a 56% increase in the number of Antibiotic Guardians in the Commonwealth. And I think it's important to note that also some countries, and I know Malaysia is one of them, have gone on to develop their own pledge system as well. And I know as part of the work we did with Sri Lanka, they also use this to go out and talk to people in the community about antimicrobial awareness. So I think it's really important to note that, you know, by using this simple, it is a very kind of simple pledge system, you can actually reach quite a lot of people, not just healthcare professionals, but the public as well, and really engage them on this campaign. So thanks, Diane. Is there one more slide here? Or is it back to you? Can you hear me still? Diane, are you there? Right. I'm not sure what's happened to Diane. Oh, I think we've got some technical issues with Diane sharing her computer slide. Has anyone got any questions so far? Oh, you're back.
I'm back. Okay, I'm back.
Okay, thank you. Was that the final slide? I think that was the final bit of my presentation. So I'm going to hand back to Diane now. She's going to talk about some resources that are available for you to use to create your own campaigns, and before we hear from some of our countries represented here. So back to you, Diane. I think Diane's having a bit of trouble getting her slides back up. Anyone got any questions, please do type them in the chat box and we will try and answer them for you. I hope you can all still hear us. Yeah. Diane?
Victoria, can you hear me?
Are you there? Yeah, I can hear you.
Okay, great. That's fine. I'm sorry, I have no idea what's going on with the technical part.
Technical issues.
Okay, so available resources. Hopefully everyone can see this.
Yeah.
Can you see the screen, the slide? Okay, great. So the next few slides are really just to showcase some of the resources that are available. Yeah, no problem. It's for you to just share a range of resources that are available for you to use. They're signposts, really. So there's WHO who have posters, leaflets, infographics that are freely available to use, and also for you to get ideas from, or for you to use to develop your own campaigns or use them as they are. You can. I'll go through how you can use them shortly. There's Commonwealth Pharmacy Association. So on the website, there's a template press release. There's the promotion of Antibiotic Guardian, and there are the webinars that you can share. The Royal Pharmaceutical Society is developing an antimicrobial stewardship portal, which I'm sure Neil will talk about. And the British Society for Antimicrobial Chemotherapy has an antimicrobial resistance resource portal as well. And obviously there's the Antibiotic Guardian website, which provides a tool for you to use for engaging with people. I'm just going to go through some other bits now around FIP. So the International Pharmaceutical Federation does have a statement around the role of pharmacists in controlling antimicrobial resistance. So I will recommend that you have a read of it to see some of the actions that FIP is urging pharmacists to do. So around giving proper counseling advice, encouraging patients to take the prescription as prescribed by the prescriber, working with prescribers to ensure that sufficient doses are available to complete or to take the full course that is prescribed, and considering how to recommend other therapies and self-care therapies for minor ailments rather than for patients to automatically assume that antibiotics cures everything. This is the poster, one of the posters that was developed by WHO last year around what pharmacists can do. So actually this could be a good one for you as a simple action with your organization to actually send it out to all your members as one way to help promote World Antibiotic Awareness Week, as well as the role of pharmacies and pharmacy staff. On the CPA website, you will find access to the webinar, the first webinar that was recorded, and a range of other antimicrobial resistance resources. And so there's a collation of activities CPA has been working on antimicrobial resistance. This is the Antibiotic Guardian website, and just to go very quickly through that, it's a pledge-based website which talks about choosing a pledge. So it's about an individual action. And so WHO, as I mentioned earlier, said there are simple actions that individuals can take. And so on this website, which is antibioticguardian.com, people can choose very simple pledges about what they want to do to help tackle antimicrobial resistance. And it ranges for the public around, going to the pharmacist first, if they have minor ailments or minor illnesses, or the fact that, one of my pledges, although I developed this, was that I will teach my children how to wash their hands singing the ABCD song, which is what WHO developed and recommends. And so now my children who are 8 and 5 will sing the ABCD song as they wash their hands. So I've not only I've also passed on that information to my children, because hand washing is a key part of preventing infections. And also RPS has did a survey within United Kingdom to show that actually the public are not washing their hands often enough. And so it's really important that, you know, there are simple actions that you can take. And when we've analyzed and evaluated, we've seen that those who choose the pledge are more likely to take an action, and it helps them to also talk to other people and to change behavior. And there are patient stories on there. There are resources, a range of resources, mainly focused around the United Kingdom countries. So the Scotland, Northern Ireland, Wales, and England. But actually, a lot of those resources are available for you to have a look at and to use to inform your own activities. So at the strategic level, so pharmacists, if you're from a pharmacy professional body, what can you do? You should be asking, you know, at the national, your government and health departments, what can you do to help the implementation of their national AMR action plan, if they have one? If they don't have one yet, how can you help them develop this? We're pharmacists, we're pharmacy teams, we are experts in medicines. We have a role in helping to shape the implementation plan and the development of the AMR action plan. One of the key areas within the action plan, or key objectives, is around better use of antibiotics, optimizing prescribing of antibiotics. So we do have a key role, and we also have a key role around the fact that we have access to the public. So there's so much we can do to help influence and shape the AMR action plans in the countries. Develop and implement antimicrobial stewardship across your organization or region or nationally. And by that, we mean, you know, what processes can you put in place to help ensure better use of antibiotics as within your organization. You can lead awareness campaigns, and I will go through that shortly. You can contribute to calls to change legislation or enforcement of regulation, which Victoria touched on earlier. And you can initiate, contribute to, or promote antibiotic consumption surveillance. So actually, do you know, is it known within your countries what the use of, what the total consumption of antibiotics is? Can you help contribute to that? So by providing data or facilitating the collation of the data. So in terms of World Antibiotic Awareness Week, these are just some very simple actions that you can take. You can use the WHO resources or other relevant resources within your countries or your professional organizations and send them to members. Or you can display posters. You'll see shortly what countries have done what they've done in India, in Fiji, in Rwanda, what actions have been taken by pharmacy organizations. So there are different things that can be done, and there are things that you can do, although we only have 38 days left. You can register your planned activities with CPA. So after the call, there will be a feedback survey that will be sent through. Please share with CPA what actions you're taking. It's really good for CPA to be able to showcase what is going on across Commonwealth countries and to be able to share that with WHO or others who might be interested. You can encourage your colleagues and members to join almost 50,000 individuals who have chosen a personal pledge about how they can act and what they want to do to help tackle antimicrobial resistance, so their personal contribution. There's some communication activities you can consider, so social media, Facebook, Twitter, Instagram. If you have a professional, your own social media account or your organization's social media account, you can use that to engage and promote key messages on antimicrobial resistance throughout the winter period. The hashtag for WHO was hashtag antibiotic resistance. It does get very crowded in the fact that it is the reach is huge, but it's very difficult to collate information from, for example, the Commonwealth countries or what is going on in individual countries. So by all means, please use hashtag antibiotic resistance as part of your tweets or your Facebook messages, but please also have CW Pharmacist as that, not CPA Pharmacy. I will change that. So CW Pharmacist as part of your tweet, so that actually that Victoria and the rest of the Commonwealth Pharmacy Association can pick that up as well and display that and showcase it. So the example we have at the bottom there is examples of those who have engaged on social media using hashtag Antibiotic Guardian. It's very easy for us to find those images and to pull them together. You can demonstrate the impact of resistance by finding case studies of those who have been impacted by resistance and sharing that. There is nothing, it's so powerful to have a face talking about resistance rather than a presentation or a webinar that we've done now. For someone who has been personally impacted, you can share that, and it creates personal stories that people can relate to rather than thinking it's a public health issue that doesn't affect them or can't affect them. You can find local spokespeople that can help you communicate about resistance and bring the issue to life as well. So as individual pharmacists, how can you contribute to tackling AMR? So if you're here thinking, actually, I'm not in an organization, I'm on my own, what can I do? Consider how you dispense antibiotics only when it's needed, according to the right guidelines and prescriptions. Encourage self-care for self-limited infections, so coughs, colds, for example. Although it's important to be careful as well and to safety net. So, for example, if you think that actually what looks like symptoms of normal coughs and cold could be something more serious, for example, tuberculosis, or for example, malaria, then it's important for you to be educated to be able to signpost those patients to a clinician or another clinician to be able to make that appropriate diagnosis. Help patients who do get prescribed antibiotics to use them effectively, so remembering to tell them how often to use it, the intervals, the fact that they shouldn't share them with others and they shouldn't save them for another time. If you are able to give the exact number of antibiotics for that prescription, then that's really good. Yes, it's important also, as I said, if there is something more underlying, for example, sepsis or tuberculosis, that you know when to signpost or send those patients to another clinician. You can help raise awareness for antimicrobial resistance. So what can you do for World Antibiotic Awareness Week as an individual? Very quick actions. You can send the link of the recorded webinar to your colleagues or other healthcare professionals once it's ready. There are crosswords and quizzes that we'll share, and the WHO has some. We also have some through Antibiotic Guardian, and we'll share that with CPA. And so you can share those with members of the public whilst they're waiting in your pharmacy. Could you print some out for them to do the quizzes and the crosswords? Could you try and get those crosswords or quizzes into a newspaper, as we have tried to do before? So just being creative and thinking about ways in which to share this. One thing to highlight, and so also you can lead local promotional campaign in your pharmacy or in your pharmacy shop or in a hospital, and you can encourage your friends and family to think about what pledge they want to take. One thing we've noticed as Victoria asked counsellors is to share what they've done for the International Pharmacy week, and it escaped me now. There's so much that went on during that day that actually you can use some of those ideas and translate them for World Antibiotic Awareness Week as well. So I'm going to hand over now. So we're going to do this in order. So examples of antimicrobial resistance or antimicrobial awareness campaigns that have been led by a pharmacy organisation across the Commonwealth. And I'm going to start with Neil Patel, who is from Great Britain and the Royal Pharmaceutical Society. Over to you, Neil.
Thanks, Diane, and hello, everyone. I've only got a couple of slides, so won't be longer than my 5-minute limit, but I'll be on the call afterwards, and as Victoria said, if anyone's got any questions, happy to answer them. So firstly, I'm Neil Patel. I am a pharmacist, but I work in communications for the RPS. And just to be very clear, the materials and the content of what I'm going to be telling you about hasn't been developed by me. It's been developed by clever people like Diane and other experts in the sector who really helped us a lot with creating both materials, both for pharmacists and for the public, to make sure that we get the right message across about antimicrobial resistance. So one of my top tips, I suppose, if there is any in this presentation, is that you work with the experts in your countries to develop materials. That's certainly been a huge advantage for us. So happy to move on to the next slide. Okay, so what were we trying to achieve in Great Britain with our campaign? So it was about creating an influencing campaign to encourage antibiotics only to be used when they were necessary. So actually in the UK, we've already got a lot of work going on to reduce inappropriate prescribing, but we set ourselves a really tough target to reduce that even further by 50% by 2020. And sorry for the abbreviation, CPHO stands for Chief Pharmaceutical Officer, and that's the senior pharmacist within the government that sets policy for the NHS and wider healthcare. And it was the Chief Pharmaceutical Officer's request, really, that made us think that we need to support that campaign to reduce inappropriate antibiotic prescribing. We obviously had some secondary benefits that we wanted to get across, and one of those was to increase the awareness of the role of pharmacists. Now we know pharmacists do a huge amount to support AMR already. That's all the way through from primary research into new antibiotics, development of antibiotics in new innovative ways in terms of administration, hospital specialists. We have pharmacists now based in GP, general practice, and we've got community pharmacists as well. So we really wanted to showcase everything that pharmacists were doing, and we wanted to support the sectors in being able to contribute to the campaign as well. And just to let you know, the work was actually kind of commissioned across the 3 countries that make up Great Britain. I suppose recognising, as we heard from Diane, that this is a global problem. It doesn't respect borders. Antimicrobial resistance is one of those issues that really does cut across all nations, and it's a great way of uniting people, actually. That's what we found. So if we just move on to the next slide. So just to tell you what we've done and what we've got planned. And I think I heard a question in the earlier sessions about so I was going to turn my microphone down a bit. I think it was. Hopefully that's a little quieter for you. So anyway, we've got great. Okay, we've got things that we've done and things that we're going to do. So what have we done already? Sorry, I was just saying, yes, all the materials I'm going to talk about are open access, so pharmacists can access them from anywhere. We're not locking these things down just for members. So firstly, we've produced some best practice guidance for pharmacists in all sectors. That's a quick reference guide, really simple, but we hope helpful advice for pharmacists about what they can personally do to take action around antimicrobial resistance. That's everything from prevention to supporting patients when they get antibiotics prescribed, to actually making sure that we also influence prescribing at a strategic level as well. So we've got a quick reference guide. We've done some media campaign work, so we've got messaging and infographics around helping the public prevent infection, particularly around hand washing. Again, a nice universal message that works, I think, across any community, and it was actually well received by the media as well. We've developed some new policy around antimicrobial resistance for pharmacists, with some specific asks for different stakeholders in what we would like them to do to make it even more, or to make pharmacists' role even more impactful. So, for example, I don't know if this is true in other countries, we sometimes have problems in accessing formularies. Different sectors sometimes don't have access to formularies about medicines, and one of our campaign asks is to make sure that all pharmacists have access to formularies so they know what antibiotics should be used. There we go. So those are resources. Then we've got some things that we're going to be launching soon in time for European Antibiotic Awareness Week and also World Antibiotic Awareness Week as well. So we've got a new portal. That URL will work, so please view it. There is actually a portal already in place. We're going to review it and update it. And that portal contains all the information that we hope pharmacists would like from other organisations, not us, from other organisations, including Public Health England and other organisations that produce materials. We're going to have a toolkit that will help pharmacists engage locally on this issue, both with GPs, other health professionals and patient groups. We're producing videos for showcasing the role of pharmacists in different sectors. We've got a visit to a research centre where we're taking important people to look at what pharmacists do around primary research and development of antibiotics. And of course, we're supporting the work that Diane talked about around European Antibiotic Awareness Day and World Antibiotic Awareness Week. And we're, as I said, we've got some policy asks and things that we would like to change that would make it hopefully even easier for pharmacists to get involved with AMR, that will be running through October and December. So there we go. Hopefully that's okay.
Thank you very much, Neil. That's really, really helpful. If anyone has got any questions for Neil, please add it to the chat box. We'll continue to monitor that. Neil hopefully staying until the end of the session, and then we can ask him those questions there. I'm just going to have a quick look now to see if there's any burning questions. No, I cannot see any burning questions for you, so we'll pick that up and, oh, hang on. Yep, we'll pick that up as part of the Q&A.
There was a question from, who was it now? I can't remember who it was now, but there was a question in the chat box regarding the use of antimicrobial soap. So should we be advising people to wash their hands just with normal soap? Is there a problem with resistance to the components of antibacterial soap? Neil, I don't know if you've got any information on that as a part of the RPS hand washing campaign, or whether Diane, have you got anything to add?
Neil, do you want to go first, or shall I go?
Sorry, Victoria, I didn't quite catch the question. I managed to mute the sound. Apologies.
Oh, sorry. So the question was regarding hand washing.
Yes.
Should we be advising people to wash their hands just with normal soap? And is there a element of resistance with some of the components in antibacterial soap, which means that we should be asking people to avoid using those for regular hand washing?
Yes, well, it was a common question actually. So the advice we were given that normal soap is as good as any other antibacterial or special soaps that people get. So normal soap is fine. Also, it's important to make sure that the water you use is clean, of course, but you don't need to use hot water. Cold water is fine. Any soap is fine, and it's about actually the length of time that you take, and also making sure you cover all the surfaces of the hands with soap, and then actually, wash all surfaces of the hands as well. So we talked around 20 seconds of hand washing, and just making sure that you cover the tips of the fingers, in between the fingers, back to the hands, front of the hands. And we put a nice little GIF file on our website that really shows quite simply how to use that technique to make sure you have covered every surface.
Okay, great. Thanks, Neil. Have you got anything to add, Diane, or should we move on to Rwanda?
No, I totally agree with Neil, and it's really about those actions. What you're doing when you rub your hands together, you're disrupting the cells of the bacteria. So I think it's really those actions and making sure that you cover every part and using clean water as clean as possible, and washing for long enough. Neil's mentioned that there's a GIF which is basically an animated way of showing the hand washing. There is also, WHO also has a good poster which talks about the various actions that you need to take, and actually that's probably a good resource for CPA to post. So I'm just going to hand over to Rwanda now, and I'm going to put myself on mute.
Right, Flandry, you need to unmute yourself, or hang on, can I do it? Aha. I can hear you, really.
Yes, thank you very much. Hello?
Can I just introduce you? So Flandry is
thank you very much for
representative.
Yeah, thank you very much for this time. Just for us in Rwanda, what you are doing, what you are planning to do. As you see on this slide, normally antibiotic resistance in Rwanda. Normally there is no research done already to mean that the prevalence of antimicrobial resistance is not well known. So for us, what we are trying to do is just to try to make a documentary video that will highlight the point above, just to highlight what is microbes, what is antibiotics, what is the mechanism of antibiotics, what is the impact in case of antibiotic misuse or wrong selection of antibiotic in human body. And we shall highlight also antimicrobial resistance, just the mechanism of resistance, mode of transmission of resistance, pathogen, and the impact of antimicrobial resistance to the human being, to the family, and to the population in general, just especially to the country, the factor contributing to the antimicrobial resistance, mode of prevention. We shall highlight also in this documentary video, we tried to think about this documentary video that will be in our local language, especially in Kinyarwanda, to be able to disseminate to our population. The purpose of this one is just to show our population the impact of irrational use of medicines, especially antibiotics, how it can affect the families, how it can affect also the population, especially the Rwandan population. We shall also, in this week, shall also talk about, especially this video will be distributed to the media houses, distributed to the social medias and so on. This one will be also distributed to the hospitals, to the pharmacies, to the districts and the sectors in Rwanda, where most of the people spend the time so that they can get the information about the antimicrobial resistance. Another activity we have on this week, we shall also have a talk show in media houses. We shall have also, we will distribute also the flyers speaking about the antimicrobial resistance, the impact and the mode of prevention. So we shall also have an antimicrobial walk in the city of Kigali, just with the t-shirt, just having the theme of the week to be able to disseminate also the message. We shall also have a research on antimicrobial resistance in Rwanda, but the time is very short, but we are trying to organize some questions to be able to collect data and see how the situation is in Rwanda. I think this is what we are planning to do this week. Thank you very much.
Thanks, Andre. That's really great, and I think it's especially fantastic considering how new your organisation is. You're doing an amazing job here with the amount of activity you've got planned. So thank you. I just want to really use this to encourage the rest of you that you know, if you don't have activities going on, you can start them yourselves as individuals or with your pharmacy bodies. And Flandre is a great example of how one person can put so much into play. So thanks, Flandre. Really appreciate you sharing. Diane, back to you.
Thank you. I'm going to might need you for this. So the next country we have is Trinidad and Tobago, and I don't know if we've got sound. I don't know what presenters are on now, Victoria. I might need your help there, please.
Junior, are you able to unmute your microphone? It looks like it's working now. If I unmute you, can you speak? Junior? Are you there, Junior?
Okay. I think Manjiri might need help as well.
Okay, Junior can hear us, but I think she's still having problems with her mic coming in.
I'm going to try and, Junior, perhaps what you could do is you could type some information into the chat box. I'm going to try and go through your slides and try and imagine that I know what you were going to say. But basically, Junior will add some information into the chat box. But from the slides that have been sent to us from Trinidad and Tobago, they're planning to raise awareness of pharmacists about their roles as antimicrobial stewards through educational workshops. They're going to recruit pharmacists as antimicrobial stewards, so and they will get them to have a photo campaign, and they will raise awareness of other healthcare professionals on raise the awareness of other healthcare professionals on antimicrobial resistance. So they host updates and hold team meetings in their practices. Junior, I hope I am reflecting this accurately. And they're going to raise awareness of the public through campaigns, health fairs, and media releases. You're also, thank you. Right. You're also planning to lobby. So who's just unmuted themselves? Is that you, Junior? Manjiri. If you can mute yourself for now, we'll get you, when it comes to India, we'll get you back online. Great. So in terms, and they're also lobbying for policy support for antimicrobial resistance. So that's to harness the support of pharmacists by influencing support to drive towards AMR by active participation in surveillance programs, and to partner with the pharmacists in the regional health authorities and private pharmacies to bring focus on AMR to influence changes in antibiotic legislation. And they're also going to partner with the Ministry of Health to place AMR on the policy agenda of central government, and so they can influence change in antibiotic legislation. I believe that yeah.
Junior's just said they've also got a health fair planned for the weekend, so I think that will be publicising the campaign even more. Just wanted to add that.
Great, that's fine. Yeah, so I mentioned the health fair, that's for the public. We'll have these slides available as well. And I believe they are also planning a regional survey on focus on antimicrobial stewardship to get a retrospective research survey. And so they've shared with us what their brief protocol is. So this is another example of how quick actions can be taken to try and start to get some data. So I mentioned earlier, how can you help contribute to surveillance? So this is an example. Audit is a good way to start to get some of that data, and you can do that locally or at a regional level. That pulls together some data that you can then share as a pilot, and that might help to also influence. That might also influence change. So Junior says that they've already started the data collection in Trinidad. So perhaps you will have the results available that you can share during World Antibiotic Awareness Week, and it provides you with some comms, communications, and some press releases potentially that you can do in that area. Okay, and over to Mauritius now. Do we have anyone from Mauritius, Victoria?
No, there's no one here from Mauritius, but they have shared with us some of their slides on some of the campaigns.
Yeah, so Mauritius has shared with us a couple of things. So they have general guidelines for antibiotic prescriptions. We believe this is a national guideline, which is one way as well to tackle this. So in the United Kingdom, for example, we have national guidance, so in terms of evidence-based guidance, but also within hospitals, there is an encouragement that actually you should know. There's somebody that needs to go on mute, please, Victoria. I need your help. There's an encouragement that for people to, thank you. There's an encouragement for local organizations to know what their local resistance patterns are, and to use that evidence base to decide which of those antibiotics within that class would be the right one for that local area. They also have a poster which they did, or an information leaflet which they did for 2016, which talks, and they used, this is what I talk about. You can use the WHO resources to influence and then just acknowledge whichever resource you've used. So they've used World Health Organization and they've acknowledged WHO there. And talking about what healthcare workers can do, and they've put the stamp of their ministry on there as well, so as a way to share information so that it has more validity within the country as well. So next is Sri Lanka.
Sakine is not online for some reason. I don't know why, but they have shared with us some of the stuff.
Thank you. So Sakina presented on the last webinar, actually. So if you want to find out some more detail of what they've been doing, do listen to that webinar. And I believe what they're focusing on there is really the fact that community pharmacists in developing countries such as theirs can make a difference, and really showcasing to them how this can happen. And a lot of this is what I've discussed already in my presentation around awareness of antibiotic, appropriate antibiotic use, appropriate antibiotic dispensing, highlighting adverse drug effects of antibiotics to patients, and also helping or ensuring that there's a stewardship program that available, and also the importance of counseling on antibiotic use. I don't know if there's anyone else from Sri Lanka online. I think I saw a couple of people from Sri Lanka earlier who have dialed in. If you want to type in some information, we'll be able to share that verbally with the team. Manjiri, just give us a couple of minutes and then we'll come to India whilst Shabira is currently typing at the moment. So we'll just take that. Okay, so that was Shabira saying thank you from Mauritius rather than from Sri Lanka. If anyone's online from Sri Lanka and would like to share, do let us know. Mauritius, Shabira, I'm pleased I was able to at least share some information from Mauritius. Thank you very much for sending the information to us in advance. So over to India now, and Manjiri, so if you unmute yourself, please. Please.
Yeah, can you hear me? Hello?
Yes, we can. Yes. Hi.
Yeah, okay. Hi. India is the biggest producer of antibiotics as well as the biggest consumer. So we have a huge problem of antimicrobial resistance in the country. As a professional association, we have two targets. One is training of the pharmacist and second is consumer education. So we have been having the campaigns on antibiotic awareness. In fact, the National Pharmacy Week in 2015 focused on responsible use of antibiotics saves lives. Before that, in year 2014, Indian Pharmaceutical Association State Branch in Bengal, they had a lot of public awareness campaigns, as you can see on the slide, and we followed up this in 2015 in National Pharmacy Week, where we had all across the nation the awareness campaigns through the pharmacy students as well as through the pharmacists, and we created these posters where you can see that there is some conversation between the pharmacist and the patient, asking the patient to do to take the self-care and should not be going for the antibiotics as the first measure. So we had all this we had created a lot of resources, the posters and the leaflets, and we had the video competition for the pharmacy students. And all over the country, the pharmacy students participated in this video competition focused on the theme, and we got a lot of good videos out of it. So promotional material, and we also had a lot of school programs in 9th and 10th standard schools for the school children. We had this program. We also have the tuberculosis project, the DOTS TB Pharmacist project, which is a public-private partnership, where we train the pharmacists for the correct rational use of antibiotics, focusing especially on anti-TB drugs and how they should be counseling the patients so that the adherence is improved and the chances of resistance, antimicrobial, the MDR, the multi-drug resistant TB cases would reduce. So that's on. Now this year we will be we have a National Pharmacy Week where we have the theme, Know Your Medicines, Ask Your Pharmacist. And that National Pharmacy Week just follows the Antibiotic Awareness Week. So in both these weeks, we'll be focusing on the antibiotic awareness through the promotional material, through the media articles, if possible the media show, but media articles for sure, and the school programs, and pharmacist training programs. We are also in the process of creating video, but I'm not sure whether we'll be able to finish it before the Antibiotic Awareness Week. So we have all these activities going on for consumers and for the pharmacists, and also some advocacy with the government is on to curb the irrational prescribing of medicines, antibiotics, as well as to curb the sale of antibiotics without prescription. But it's a huge country and we have many challenges here. Thank you. Hello.
Thanks, Manjiri. That was really great.
Just say, well,
hello.
I was just typing in the text box to say that it's great to hear so much activity going on in India. I know it's not an easy problem to solve at all, and it is a huge country, as you pointed out. But it's great to hear so much activity, and I'm very impressed by the video. So thank you very much for that. And we'll save questions till the end, I think.
And just to add to that, I mean, just to add my thanks, because I pulled together the slides from the information you sent, and you sent a huge amount of information which is on activities that are ongoing, and hopefully that will be added to the CPA website, because I think it really should be shared. So well done for just presenting that based on the slides. Something I was going to say is that the videos that the students created, you shared one of them with us, and we were going to try and show this on here, but we're having challenges. It will be great to have those available, for example, maybe on YouTube, so that we can embed them and share them wider, because some of those messages by the pharmacy students are really good. And actually, I'm inspired by that option of actually, why don't we, even within UK, consider what we can ask pharmacy students to do, because they are young, they have innovative ideas, and sometimes we need to just see what they can come up with as well. So that's a really great tip that I've picked up from your campaign. Thank you.
Yeah, it's really great. And just to reiterate, we will be sharing the video via our website. So we can't really share it via this platform at the moment. We haven't got the capacity to do that. So we will be putting it on our website, and Manjiri has given us the permission to do that. So thank you very much.
Okay, so the next, we've got one more country to present, and then we've got questions and answers. So it is 2 o'clock. If you do need to dial off, please do. We hope the presenters will stay online for a little bit longer though, and hopefully we'll be wrapped up. I think we actually booked to be online until 2:30. I think that's what we put the webinar session to be. So actually, we still have half an hour. We'll be done within that time. So to Fiji, so many thanks to Fiji colleagues who provided the slides for us and have asked us to present on their behalf. It's the Fiji Pharmaceutical Society, and they have a range of activities ongoing already. There's some work going with their National Action Plan, which is available on some slides they've sent. We've not put them here, but we'll make sure that that's available through the CPA website. So they've had dedicated slots to discuss antimicrobial resistance at their conferences, and also guest speakers from Australia at their conferences as well, all focused on discussing antimicrobial resistance. This was just some pictures from their conferences, which just shows a range of workshops as well as issues discussed and brainstorming ideas, as well as presentations, really to try and tackle antimicrobial resistance and what role pharmacists have in doing that. They've also, so the main ideas that came out of their conference was around the importance of vaccinations, well, possibility of vaccinations from pharmacies, and that leads us to the fact that FIP is currently working on I think it's FIP, or working on a survey around vaccinations through pharmacists, and they've asked CPA to collaborate with them on that to cascade it to the various Commonwealth countries, and we'll be doing that as part of activities for World Antibiotic Awareness Week. The importance of better hygiene awareness. Yes, prevention is better than cure. For every prevention, if you prevent an infection, you do not need to use an antibiotic, and you prevent antimicrobial resistance. You contribute to preventing antimicrobial resistance. The importance of starting stewardship programs in communities, pharmacy settings, and also the pharmacists have a role around patient education through media platforms. So yes, within the UK certainly, we have pharmacists who are spokespeople and media spokespeople to educate around AMR, as well as a range of other topics, but specifically around AMR as well. So actually, there is a good point there that pharmacists have a key role in educating the public through media platforms. They have appointed a project officer for the antimicrobial resistance. Sorry, the Ministry of Health has appointed an AMR project officer, and that officer is a pharmacist and is responsible for coordinating awareness programs, stewardship, and meetings for the National AMR Committee. That's an interesting point. This is very similar in the UK, actually in all the countries within UK. Pharmacists are very much involved at the national level. So for England, I'm one of the pharmacists, so I work for Public Health England, which is part of the Department of Health, and I work really as part of developing the AMR Action Plan and implementation of the AMR Action Plan. I'm also the national lead for World Antibiotic Awareness Week for UK, and in the devolved administrations as well. So in Scotland, Northern Ireland, and Wales, there are they have got pharmacists in the public health agencies there as well, who are leading work on antimicrobial resistance. This is what I mean by the fact that pharmacists have a key role, and we have a key contribution that we can make through the Ministries of Health and other national AMR committees. And the others here is just some pictures of some of the activities. So again, similar to what's happened in other countries, where there are public awareness messages on trucks, which go around, and there are, the key messages there around antibiotics handled with care. Okay, I'm going to just pause now for us to have time for some questions and answer sessions. If Victoria wants to, perhaps, if any questions that have been asked before now, if you wanted to share what they are, Victoria, please, and then I can then also provide some through here. So it's really now, a huge thank you to everyone who has contributed and provided us with slides, the presenters who have joined us today. We really couldn't have done this without you. We hope that you've been inspired by the fact that you can do something. There's still 38 days left, so you can still do something for World Antibiotic Awareness Week. Let's put Commonwealth countries on the map with WHO for having activities for World Antibiotic Awareness Week. So this is the Q&A session. Please type in your questions via the chat box. And if you want to say what country you're from, it just helps us to contextualize our reply. So I'm going to pause now and hand over to Victoria if there are any questions that she's already.
Thanks, Diane. Really appreciate that. It was a great presentation from you and from our other presenters, and I hope you're inspired. I certainly am, to see what's been going on around the Commonwealth. We've got a few questions coming through here, so Junior, the slides will be available on our website as soon as we can get around to putting them up, so it'll probably be either tomorrow or early next week. And we will also send out a short MCQ type survey, so if any of you want a CPD certificate, if you fill in the survey, you can then we'll send you a certificate. If your colleagues would like to listen, or you'd like to spread this amongst your organisations and networks, we will be making the webinar available on our website as open access for the next month, and hopefully that should go up either late this week or early next week, and that means that people can listen and also answer the survey at the end of that to still get their CPD certificate. So if you wanted to use this as something your member organisations could send out to your members for the next month where it's free access, then please do. After that, we'll be restricting it to members only. So there's a few more questions coming through. There seems to be a lot of talk about the involvement of youth and students. And I think that's really key to some of the social media campaigns because they are very tech savvy. They're very good at making videos, and I think Manjiri demonstrated that through the video she sent to us. So we'll try to, well, we will upload that video to our website as well, so you can have a look. As part of our AMR campaign this year, we will make sure that we've got the resources on our website on the AMR page, so you can access these to use for your campaigns, to spread to your networks and organisations. And it's great to see so much activity around the Commonwealth. I think we held a similar discussion with our councillors last year, and there's a notable increase in people's awareness of what World Antibiotic Awareness Week is, and the engagement of pharmacists in actually running campaigns and publicising this message. So I think it's really good to see, and you should all be very encouraged by that. I know there's a lot more we can do, and we are working both with your member organisations and trying to influence governments as well. We do have the Commonwealth Heads of Government meeting coming up in April next year in London, and I was just talking this morning to the UK Department of Health about us hosting a possible side event on AMR. So really appreciate your engagement with preparing for that and trying to get across the messages to your health ministers that you need us to get across. So please email us, and we'll be sending out some questionnaires and chatting to you more about, you know, how we can try to get messages across and what are the actual issues in your country that you need us to ask them to address. So it's all quite exciting here in the office.
Sorry, there's some more comments coming through.
Yeah.
There's some more comments coming through.
Yeah.
As well. Just don't want you to close the meeting before we go through them. Okay. I just wanted to say something in response.
So I'm thanking you.
Just a response to the students bit, something I forgot to say, and actually, you know, it is possible that students are planning things already, that they just need someone to connect with to help them amplify it. So I'm going to give an example in England. There will be a conference this year for students, and it literally has been the students who came to me and said, we would like to run a conference. And they tried to do that last year, but it was too late, and they helped to pull together a toolkit for students, which is something I've not shared here, but we can provide that available as well. So they developed the toolkit last year. This year, they have been organizing a conference which will be for students. What has been great is students and very recent graduates who've led it. But they literally came to me and said, we would like to do this. And sometimes it's about you as qualified pharmacists being available, especially within organizations, to say, if you have any ideas, we can help you do this. And so my role has been to help them make sure that they deliver this workshop and they deliver this conference, and helping to facilitate the conversations with other organizations. And so we're so proud. And actually, they are pharmacist students, so we're very proud of them. And what they've done is brought together a multidisciplinary group, and it's a One Health conference. So they've gone out and found medical students, dental students, nursing students, veterinary students to pull together within their committee to pull together this conference. So this is just to share with you that, you know, look out for those students who would like to do something, and I'm just waiting for someone to say, give us the idea. Someone just talked about Twitter on here. If you're on social media, please connect with CPA on Twitter, on social media. If you use the hashtag CW Pharmacist, it's easy for us to pick up from wherever you are and wherever the tweet is. Victoria and I's Twitter accounts are also there if you want to follow us on Twitter. And also social media is a great way for you to share messages very quickly. So if you're not on social media, either as an organization, as a person, it's something for you to consider. I don't know if there are any other questions that I've missed here. Oh, it's great to see some connections happening.
I don't think so. It's just a lot of networking going on in the chat box now.
Sorry?
I think, Diane.
I can't see any questions, but I can see a lot of connections going on.
I think it's mainly networking in the chat.
I've just noticed that. So what we'll do is we'll keep that chat box open after we close the webinar, so you can all connect a little bit more. But we will need to shut it down. We will need to close it at 2:30. So if you want to make any connections, do so in the next 15 minutes, and also get those contact details whilst you're doing that. Vicky, I'm going to hand over to you now because that is all I have to say for this session.
Fantastic. Thanks, Diane. And thank you to all our presenters and for the participants for joining us. I have to also mention Adam Phillips, who's helped us out with the IT. I don't know if he's actually online at the moment or if he's just popped away briefly. But thank you very much, Adam. We really appreciate your technical support. Really hope we can carry on talking to all of you, and we will send out a survey to all of you that registered for tickets so that you'll get a chance to do your CPD or receive your CPD certificates. But if you have any ideas or anything that you want to talk to us about, then please do contact us, and please follow us on Twitter. Let us know what you're doing for your antibiotic awareness campaigns, maybe as a result of this webinar even. That would be fantastic. We'd love to hear from you. So hopefully we'll meet again at AMR webinar 3 then.
We'll be ready. If you've got any ideas of what topic you want us to talk about, do let us know. We do have an idea of what we'll do over the next, I think we've got 3 or 4 more to complete it. But if you've got any other ideas, do let us know and we'll put them on, or we'll consider them as well.
Yeah, we tried a different webinar platform this time because we had some issues with the one last time, but I think maybe it's a question of some countries have difficulty dialing in. I'm not quite sure, but so sorry for those of you that haven't been able to come online with your sound. I don't know if there's anything that we can do to address that, but we'll certainly look into that. Thank you. So I'm going to mute now and say goodbye, but if you want to carry on chatting in the chat box, please do. And we'll speak to you all again soon. Have a great day.
Thank you. Thanks, Dan.